Hi, I'm Dr. Vincent Simokovich, and I'm a chiropractor with over 20 years of clinical expertise. You're probably online right now because you or a loved one is suffering from a chronic debilitating syndrome called fibromyalgia. Or maybe you're online because you're suffering from chronic pain and fatigue, and right now you're trying to find a primary healthcare professional who understands fibromyalgia and has had success in treating people with this condition. I want you to know that in our clinic we've had phenomenal success in treating patients with fibromyalgia and chronic fatigue using a neurometabolic approach, and that's what I'm going to be talking about today. Fibromyalgia is a chronic condition that affects approximately 6 million people in the United States, and for reasons that are still unclear, 90% of those who are affected are women. Some of the symptoms typical for fibromyalgia sufferers are chronic pain in several areas of the body, sleep disturbances, stiffness in the morning upon awakening, headaches, irritable bowel syndrome, painful menstruation, numbness or tingling in the extremities, restless leg syndrome, sensitivity to temperature changes, and cognitive and memory problems. And these are referred to as the fibro fog. When it comes to fibromyalgia, it's not a multiple problem. Basically what that means is that if you have pain in the muscles of your neck and in your shoulders, and if you have pain in the muscles around your hips and your lower back, and if you have pain in the joints of your hand and in your elbow, the muscles and the joints that are hurting are just the symptoms of an underlying cause. Think about it this way. You've probably had fibromyalgia pain for years and possibly decades at this point. And you've probably been on a laundry list of medications, and what have those medications done for you? They've treated your muscle and joint pain. So if treating muscle and joint pain were the solution to your problem, then you would not have fibromyalgia right now. So there's got to be another underlying cause, and that leads me to my next point. What the latest scientific research states about fibromyalgia and chronic pain and fatigue is that it is neurogenic. What this means is that the pain is in your brain and in your nervous system. As I had mentioned earlier, our approach to treating fibromyalgia is a neurometabolic approach. This involves doing extensive lab testing to evaluate every system in your body. The metabolic testing includes blood work to evaluate what's happening with your liver, your thyroid gland, your pancreas, and several other organ functions. We do salivary testing, which tells us if there is stress on your adrenal glands. We evaluate brain neurotransmitter, and that tells us what's happening with your brain chemistry. We also test for food sensitivities to gluten, soy, eggs, cow milk, and several other things that may be causing an inflammatory response in your body. We test for parasites and bacteria in the digestive tract, and we also do cytokine testing to determine if there is an autoimmune response going on in your body. Once we find the source of your problem, we restore normal metabolic function with nutritional support and dietary and lifestyle changes that may be necessary for healing to occur. We deal with the neurological component by restoring normal brain and nerve function. Many times with fibromyalgia patients, I may find that there's a problem in the function of the left hemisphere of the brain. And in some cases, I may find a mesencephalon that is overfiring. The mesencephalon is found in the upper part of the brainstem. Basically, we leave no stone unturned in getting to the cause of your problem. Hi, I'm Dr. Vincent Simokovich.
And I'm Dr. Sam Galati.
If you're tired of taking drugs and pain medications that haven't worked in eliminating your pain and fatigue, drugs that expose you to their dangerous side effects,
If you're tired of living with pain and you're ready to make the necessary changes to get your health back so you can return to enjoying your life, we want to help you. Fill in the information box below and we'll send you a copy of our newly released DVD that explains in detail how we help fibromyalgia sufferers beat their pain. We look forward to helping you put an end to your fibromyalgia pain once and for all.
I'm Dr. Simokovich.
And I'm Dr. Galati. Thanks for watching.